well, we're going to officially hand it off to our president, Chris, who's going to be doing the introductions. But I'm Lori Pepinell, I'm the CEO, and I want to thank everyone for being with us this morning, and of course, all of our guests. We're so excited to have everyone here today. Chris?
All right. Good morning, everybody. Can you hear me?
Yes.
Good?
Yes.
Yeah. I am Chris Schwab, president of the Southern Ocean Chamber of Commerce. On behalf of myself and the board, I would like to welcome you to the Southern Ocean County Chamber's April membership meeting. As we go into our 107th summer, there are many questions that our business community has been sharing with us. We are honored to have with us this morning our New Jersey 9th District Legislators who have been representing us in Trenton. First is Senator Chris Connors. In addition to serving Lacey Township as mayor, Senator Connors was elected by the Republican County Committee members and was sworn to the General Assembly September 1989 and has been serving our district ever since. He has received many honors from local and statewide organizations, including an American Bar Association Award for Excellence in Municipal Law. Next would be Assemblyman Brian Rumpf. Assemblyman Rumpf served as mayor of Little Lake Harbor Township and is the founder of the Great Bay Regional Police Athletic League and continues to serve as its chairman. He was selected by the Republican County Committee members and was sworn to the Assembly in 2003, and where he has been continued to be re-elected and is presently serving as a member of the Assembly Oversight, Reform, and Federal Relations Committee and the Assembly of Health Committee. Next on the slate is Assemblywoman Diane Gove. Assemblywoman Gove served as a beloved teacher at Southern Regional High School, where I did graduate from, for 32 years and represented Long Beach Township as Commissioner Mayor. She was sworn into the Assembly in 2009, where she has been re-elected. Diane authored the Veterans Business Assistance Act, signed into law in 2011, and currently serves on the Assembly Military and Veterans Affairs Committee, the Assembly Higher Education Committee, and the Assembly Aging and Senior Services Committee. Also this morning, we would like to welcome Coordinator of Community Health Services at Ocean County Health Department, as well as the current mayor of Lacey Township, Peter Curatolo. Peter brings 15 years of public health service and experience, disaster preparedness, environmental health, alcohol and drug prevention, and communicable disease. In addition to being published author, he serves to the Ocean County Business Development and Tourism Board and the Human Services Advisory Committee. And before we have Senator Connors speak, I would like to welcome and recognize Commissioner Vicari, who is attending the meeting this morning. Again, thank you. I know you introduced yourself this morning, so thank you for attending. I believe Senator Connors is on the call now, correct?
That's correct, Chris. I'm here.
All right.
Everyone can hear me all right?
Yes.
Okay, thank you, and good morning to all. Commissioner Vicari, it's nice to have him on. Mayor Curatolo, my colleagues, Diane, Brian, Lori, and all the members of the chamber. We want to first thank you for allowing us to participate in this conference. Certainly, all of us have been facing some very difficult and challenging times in the state of New Jersey, as well as all over the country as a result of the pandemic. But as we all know, New Jersey is not necessarily a business-friendly state of New Jersey. We've, in addition to facing the current challenges, you folks have already had to deal with issues like paid sick leave, minimum wage, gas tax increases, plastic bag bans, the recreational marijuana law, which is going to impose employer responsibilities, healthcare laws, and now our recent challenges along the coast are the proposed wind turbine projects. All of that, and then confronted with a number of executive orders which have caused great deal of difficulty on our small business operators, not so much some of the big box stores and so forth, but certainly our small business operators have been confronted with those executive orders as well. I can tell you that our legislative district office has been as active as we possibly can. Our office has remained open during the pandemic. It was closed for people to come into the office, but we've been operating with a full staff throughout. However, that having been said, I would say that probably 90% of our time has been preoccupied, not with just the constituent services, but in particular unemployment. I don't have to tell you folks what the unemployment figures are out there, but in the 9th District alone, we have over 57,000 residents that have been forced onto unemployment. And then you multiply that times 40 legislative districts at the minimum, and you get a handle as to the burden that is placed on the unemployment office and Department of Labor in the state of New Jersey. And just when things were beginning to open up, the governor had instituted a furlough policy, which then meant there was even less people in the Department of Labor to handle unemployment claims. So as of February of last year, we had about 43,000 of our constituents receive over $600 million in family sustaining benefits, about an average of $14,000 a claim. We've been dealing specifically with over 2,000 residents that have had difficulty in gaining their unemployment benefits, but that tells only part of the picture. The other part is the effect that it's had on all of you folks, because it's created two problems. One, because of the business closures, but when we begin to open up, we have a number of people that are not as willing to go back to employment because the unemployment benefits, when they do receive them, sometimes match or become even greater than what they may have been making in the workplace, and they're reluctant to come back. So the labor market has been tremendously impacted. And I can't say as I blame folks necessarily, because child care has become a significant issue with the closure of many of the schools or the remote learning aspects of the education. And so the problems are extremely enormous. We object to many of the executive orders that have been put in place by the governor. We understand the need for them. However, we often question the equity in many of the executive orders. They were applied, in our point of view, inequitably. For instance, the small business owners were affected, I think, even worse than the larger ones. Big box stores were allowed to be open. People could stand in line, hundreds long, waiting to get a couple bags of mulch out of Home Depot, but were restricted in going into small boutique or retail stores. We had bicycle owners, shops that had to close. People were not allowed to go in those stores, but they can go into Walmart, buy a bicycle, only because Walmart also sold tomatoes. So that there were a number of inequities. Residential building was closed at one point, and we all know that residential building doesn't require that many people on site. Often they don't for single family homes. Anything that would require social distancing can certainly have been met. Two people that would be more than 6 feet apart would be carrying a piece of lumber that was more than that in distance. But yet you drove down a parkway and you saw milling machines operating, ready to back up to paving equipment, and you would have 30, 40 workers huddled without mask, without social distancing. The difference being that they were private sector employees in the union, and in the private sector employment, small business operators were not. And so we had fought, even to the extent of going to court, and also co-sponsored legislation that would overturn the governor's ability to enact many of the emergency orders, all of which had failed. So when this question as to whether the governor has the legal authority, he certainly does. That was an act granted by the legislature to the governor many years ago. And the only way to change it is by legislation, which the governor's party will not allow that legislation to go through. And even if it did, he wouldn't certainly sign into a law, a bill that would restrict the powers that he now has. So the office holds itself available to any members that might have specific questions. I know we have distributed information regarding Economic Development Authority and the grant program. And certainly we're here to address any questions that you may have. But again, thank you so much for hanging in there. I do truly believe that there's an end in sight, and I do believe that we're going to have a very robust recovery beginning this year. That's all.
Thank you, Senator Connors. Lori, quick question before we move on to Assemblyman Rumpf. Are we doing questions at the end if anybody has any?
Yes, please
Okay.
put your questions in the chat. We received questions prior during registrations, and we did submit that to their chief of staff. But if there is any additional questions, you could direct email or chat Kate or myself, and we will make sure that that it gets addressed.
Okay, great. Thank you. Okay, again, thank you, Senator Connors. Assemblyman Rumpf, floor is yours.
Thank you, and good morning, everyone. Can you hear me okay? It's a pleasure to join you all. I've long had a local business in Southern Ocean County, which my wife continues to operate in my absence as I work with Peter Curatolo at the Ocean County Health Department, but I certainly can understand the challenges, the struggles, but most importantly, the rewards that all of you share as small local business owners. Just one word on health, if I may. I see Commissioner Vicari present as well. We have reached that point with respect to the COVID vaccinations where we've hit a little bit of a saturation point. And so I would just like the message to be out there that if anyone is in need or desires to receive a COVID vaccination, please let us know. There are spots available, same day appointments are available. There is no longer any challenge in getting anyone to get a COVID vaccine. We do await the J&J reauthorization. We're all aware of that pause, which probably played a large role in how quickly there was an availability of additional appointments. I think there's a lot more hesitancy, but we really are hopeful that we're going to see an end to this COVID pandemic so that business can get back to normal. And I think that in and of itself will solve more of the problems that we're here this morning to discuss than anything else. But I've been assigned, if you will, two topics to speak briefly of before the group this morning: pot and wind. They're not mutually exclusive by any point of view, but I happen to have the good benefit of being on several committees within the Assembly, one the Oversight Committee and the other the Health Committee, where combined between the two of them, I've participated in a number of discussions and a number of hearings concerning the arrival of wind energy and also concerning the arrival of both medicinal and recreational marijuana within the state of New Jersey. I've been a participant in hearings throughout the state on both these issues. I've met numerous times with stakeholders concerning both these issues, and if you don't mind, I'll just give you a very brief report from the business perspective on each of these two issues, which do remain somewhat controversial. So I'm going to leave the politics out of it, certainly. But essentially what we are dealing with respect to wind, to cover that first briefly, Ørsted, you may have heard the name, is the company that was awarded essentially a 183,000 acre leasehold interest for the construction of its wind turbine field. It's known as the Ocean Wind Project. And essentially what it will do is it'll generate 1,100 megawatts of power to join the grid in the state of New Jersey. Just by comparison, the former Lacey Oyster Creek Nuclear Generating Station, Peter can correct me if I'm wrong on this number, but that was about 650 megawatts. And so we're almost doubling the output with just the first round of wind that we're going to see constructed off of our coastline, essentially from South Seaside Park down to Atlantic City is the area in which this first lease is going to be constructed. There have been hearings held. There were 3 hearings actually this month, the last of which was just a few days ago. This is going to be subject as we move forward to both federal and state regulation. And essentially, when we have all these turbines in operation, they're going to be connected to the land either through the former Oyster Creek spot or through the Beasley's Point spot. If you're heading down the parkway, the former coal facility on the right-hand side as you're heading towards Cape May, right around exit 25, that's where the second location for the joinder of the power line will be for the wind. With regard to marijuana, because I know we don't have all day, and I want to touch on a few points briefly. We had formed, by virtue of operation of a bill which was signed into law a little bit more than a month ago, a new state department, and that department is the New Jersey Cannabis Regulatory Enforcement Assistance and Marketplace Modification Act, and that is known as CREMA. That's the acronym which has been given for the new marijuana agency. They conducted their first meeting only within the last week. Many people are wondering why, if New Jersey voters approved marijuana in November, we don't see it proliferating more as we walk around our communities. The simple reason for that is right now, although it is in fact a legal substance in New Jersey, people cannot use or possess marijuana until this new state agency adopts the appropriate rules governing how it is going to be enforced, how it's going to be sold. We are in a transitionary time period now, and the best guess is that it will not be commercially available until early 2022. That doesn't mean it's illegal, but it means it is not available for sale. Essentially, insofar as the employment aspect of the new marijuana law and how it affects employers, the new law prohibits an employer from taking adverse action against any individual solely because that person uses recreational marijuana. In the past, it was an illegal substance and it could get you fired. That is no longer the case. And in New Jersey, we have a new protected class of citizens, just as those who may have medical protection due to handicap, protection as a result of race, religion, etc. You now have a new protected class of recreational marijuana users. Employers, however, may still maintain and enforce drug force policy within the workplace that prohibits the use or possession or being under the influence while an individual is at work. However, you cannot prohibit somebody from enjoying recreational or medicinal marijuana while they are not at work. The only exception is that if somebody works under a federal agency or a federal contractor within our legislative arena within the state of New Jersey, there are other exceptions which we would expect are going to be carved out as time goes on, reflecting safety concerns. And what I mean by that is there are a number of jobs where you have to ensure that you have the requisite attention and ability not to be impaired by your use, perhaps in the evening before or the morning before work, where even any level of impairment that may not give rise to a finding that you're not able to drive a vehicle may still be an impairment as such that it would factor into your ability to do a job that is somewhat hazardous in nature, that requires special skills. Senator Sacco from North Jersey has introduced legislation, and there are other senators and assembly people that have introduced legislation to create carve-outs to specify that with certain categories of jobs, marijuana would continue not to be appropriate. The one distinguishing fact with respect to the legalization of marijuana and how it impacts us in the workplace is unlike previously, where the mere use of marijuana would be enough to get you sent home or to get you fired. Now, if there's a suspicion that someone is impaired, no longer will a simple drug test or a urine screening be enough to determine whether impairment exists. You as an employer would also have to retain the services of what in the criminal justice parlance is known as a drug recognition expert, somebody that holds a certification that would allow them to make subjective and objective findings with respect to a person's degree of impairment. That person would have to be brought in by you, the employer, in order to determine whether somebody is under the influence of marijuana before you can take adverse employment action against that individual. So that is one of the key takeaways that we're able to give you now with respect to marijuana in the workforce and how the new law directly affects all of us as employers. So I'll leave it there for now. Obviously, this is a new and greatly developing aspect of the law in the state. And frankly, much like COVID and the manner in which rules and regulations have been handed down to us by the state Division of Health, I think we are going to find that there remains a lot of confusion and a lot of work in progress as we attempt to navigate what's going to be a very tricky realm of employment responsibilities and employment law with respect to marijuana in the workplace. So thank you all for allowing me to share a little bit on those two topics, and I leave some of the more other relevant and current topics to my good friend and colleague, Assemblywoman Diane Gove. Thank you.
Thank you, Assemblyman Rumpf. Assemblywoman Gove, you're up.
All right. Well, thank you all very much. Good morning, everyone. Thank you. I want to thank on behalf of the delegation again, thank you for having this opportunity for us to speak and interact with you on this day about some really pressing issues for small businesses that have occurred this past year with the pandemic. I just want to say that I truly believe that our delegation has had a great working relationship with the chamber. And I want to thank, this is even before the pandemic and even during, well, I guess we're still in the pandemic, we're still in an emergency situation, but we've had a great relationship. I want to thank Lori for that. During all last year, I was sending you all the press releases as I would get them to help you in, because it was an ongoing, it was day to day, minute by minute, and trying to keep the delegation, the chamber apprised of what's going on. And so thank you, Lori. Thank you, Kate, for being there.
Thank you, because you were the hardest. I mean, I would get calls from you all hours. You were working, you were making sure we got the stuff, and we were sending it out as fast as we could. It was pretty fast and furious last year, and we do appreciate all the work that you did. So thank you.
Our pleasure. It is important because we're really all a team here. And I want to, as I said, thank Kate and Chris. I've known everybody. Chris, I've known a number of years that, as in education, as a mayor, now as assemblyman, and he's very tremendously respected in the business community, but I also see him as a gentleman. So thank you so very much. And if you might hear my dog just woke up, so he'll be antsy. So anyhow, I'm so happy that I've been able to have these relationships because my history, as you know, as Chris said, and you all know, I'm a lifelong resident of Long Beach Island, now a native of a, what do I want to say, a kidster community over here in Barnegat, but I'm happy. But it's been great to work with you. I remember as age here, the Board of Trade and how it's grown to help businesses throughout these number of years, and how we continue to work together with the elected officials of municipalities, the county, and of course with the state, because we're all in it together. And especially during this really difficult time, our businesses, everybody got hit, but our businesses especially. So we all really needed to team up here. And it was an ongoing, every day, something different type of thing. And as the senator said, the lockdowns with the governor and his executive orders, in the beginning, we didn't know what was going on, but as time progressed, as you heard him say, what's good for the goose should be good for the gander. And you small businesses really got hit tremendously. And I think one of the things that our delegation is very proud about is trying to help your businesses during this time, and as we continue. And as time progressed, when things did start to open up and bills, laws started to, we started trying to help businesses and communities during this time, the delegation was very, very strong in the interests of small businesses. And just to let you know, some of the bills that we were very supportive of, and one that was very important to everybody, was allowing restaurants, bars, distilleries, breweries to use the outdoor spaces and located by their business, and to food and beverage sales, including out on the sidewalks or the parking lots or whatever. I think that was really important. It took a while, but I think that's slowly, as summer came last year, things were able to open up. We were very proud to be part of that, and continue to be part of that. And then as recent as now, $25 million in federal funds, we supported that bill, is available in EDA grants to micro businesses and that produce goods and services and that have 5 or fewer full-time equivalent employees. So it's really for your small businesses, and we've been supporting that. And I know there's a lot going out with EDA, and we've given you some information, Lori, that I'm hoping that you're going to be able to give to your. It's very, very complicated, but I mean, we could just do a session on that. So I hope when you distribute this, if anybody needs assistance, please call our office, and we'll try to navigate the system with you. But also, we've also supported $35 million in federal funds, again, in EDA awards to restaurant and bars with 50 or fewer employees and who need the support with the public health during this whole pandemic. So again, we're trying to help these businesses. Another one that just was signed was $15 million in Fed funds available to the EDA and the New Jersey Council of Arts. I saw Steve somewhere around there. So there is, there's money there. Again, our delegation has always supported the arts, the culture, especially in our area, historical culture, being a former retired history teacher. So we've been supporting this. So there's been all different monies coming from the federal government to try to help these businesses. Now another one, and I saw Wendy there, that there's $50 million in Fed funds to grants into businesses and nonprofits. So, so there's a variety of money there. And again, these were all signed and all come very quickly since April. $10 million in Fed funds to grant childcare providers that are in need of support. So these are all things, all these not only help with money, but also support the businesses. And it's not just the business, but it goes all the way around. Families, businesses. If you can help the businesses, it helps the families. It's all a domino effect. Another one that's very, very ambitious that we did support, and it's on a very large scale. It's called the Economic Recovery Act, which provides for a total of 11.5 in tax incentives for new or expanded programs over a period of 6 years, and the option of a 7th year if the overall cap has been met. So that is it's very complicated and it's a very, very, a much larger one than the other ones. Now, we have been very, very significant during this time to help our businesses, but there have been some bills that have been passed that we didn't support because they were not helping our businesses. And one actually came, the bill that, one bill I'm talking about is the 2016 tax gas, the gas tax. And we were totally against that because we knew that somewhere along the line, part of that, part of this 23 cents a gallon increase was going to hurt the businesses. And we saw that last year. And that was because there wasn't a lot of travel on the road. There wasn't enough, people were at home and, well, I don't have to tell you that. But anyhow, they found that the reserves in the for the gas was not enough. So lo and behold, they have the option. It says it in that bill. We knew it was going to come back to bite you, that they increased that gas tax back in October. Now I'm hoping it's going to go down. I do see it every once in a while. It goes up, goes down. But the other part that we were always opposed to, but it didn't come in the form of the bill. The governor was able to add toll increases. And as you all know, which part of New Jersey gets really hit with the toll increases? Southern Ocean County. And I know Commissioner Vicari, all the commissioners in Ocean County are always opposed to that because we get hit the most. So, but the governor, asked him to veto those tax increases, but sadly enough, they were raised during this pandemic. So there were things that did not help us. On one end, there's money coming in. On the next end, that money that's coming in is going out. And I know the senator talked a bit about the plastic and paper bag ban. Well, that we know that was passed before it, but was to go into effect now. We are very environmental, being a coastal community, but parts of that plastic bag bill, as you know, there's two. The first one added taxes, you had to pay for them. The second one was it put hardships on your businesses. Here, you have a store, you have a takeout, it's putting hardships on there, such as, if you're taking out, what is the, what do I want to say? The materials. You can't use certain materials for your takeout products or paper bags. So in one respect, yeah, it's helping, but in another respect, at a time when it's very, very crucial for small businesses here, it's putting some hardships on them. And we've always believed that it should be in the hands of the local communities to do this. Again, it's been really tough during this period of time. We don't like Trenton raising taxes, fees for anybody, but even businesses, especially during this crucial time. But as the senator had said a while ago, we'll get through it. And it's two different things, but similar. Sandy, we were totally hit and we're devastated. And it took a while, but we got through it because we were a community and everybody band together. So out of some negatives, you're going to see some positives. And I think that's the same with this pandemic. Last year at this time, boy, everybody was helping one another. And that, just like after Sandy, everybody helped, businesses, people, trying to get people back on their feet in their houses. Here, trying to get back on their feet, helping businesses, helping those first responders and helping them. So I think we have a tremendous community here. The businesses are always there helping support people in time of need. And in time of need, when they needed it, I'm hoping people supported them. And I think last year they did, and I hope they continue to do that. And once again, I thank you for inviting us. And as the senator said, Brian said, we're here for you, whether we're here for you on the Zoom or you call. I'm putting in a plug in for you, Jason. Call Jason or us at the office, and we'll be able to, we'll connect with you because, as I said, and I truly believe, I've lived here my whole life. This is my community, and I'm invested in it, whether I'm living on that island or whether I'm living here in Barnegat. We need to work together, and we do have a great community. So thank you, and I appreciate you inviting us.
Thank you, Assemblywoman Gove. Okay, next in our list of speakers is Peter Curatolo. It's all yours, Peter.
Thank you so much, Chris. And it's a great honor to speak for just a few minutes here today about some of the important work going on here at the Ocean County Health Department I'd be remiss if I didn't mention the efforts and the support of our board of chosen commissioners, and Commissioner Vicari in particular, as well as the entire 9th District, Senator Connors, Assemblywoman Gove, Assemblyman Rumpf, in their capacity, in their official capacities and in that of outreach. They've been strident supporters of our municipalities at the local level, as well as our business community, our veterans, our seniors, and our schools. And for that, just as a regular resident, I'm very, very grateful. And it's an honor to be a small part of this team. So with the Ocean County Health Department, I will try to switch, this will be a first, to a very short PowerPoint. I think that's it. So our Community Health Improvement Plan, and again, this will be short and I appreciate everyone's time. The Community Health Improvement Plan, or CHIP, is a legislated part of public health practice standards. Ours is the largest health department in the state. We're usurped only by the state health department itself. So our scope of services is broad. The plan itself is really the culmination of work of about 70 or 80 very high-ranking individuals in our county in the realms of public health, law enforcement, private health, hospital associations. They came up with 5 health indicators. And it's up to me now to reach every demographic part of our county, every geographic part of our county, and every really demographic group in our county to get those services out. Speaking specifically to diabetes, cardio and cerebrovascular health, also drug usage, mental health, and of course, access to care. So they say if you do the same thing you've always done, you're going to get the same result. So with the guidance of Brian upstairs and our Board of Health, and of course our Public Health Coordinator, I've made a concerted effort, especially during this COVID pandemic, to reach out to our business community. You say, what does business have to do with health? Well, I want people to know what we do. It's my job to really share the services with our business community. We don't want to walk into a business, do an inspection, and then leave. We want to tell you why it's important to have healthy employees. And so we'll start with slide 2. These are just some of the costs. In particular, one of the things that jumped out at me as I did some of this basic research was this second bullet point, chronic diseases, and we call that presenteeism, where people may show up instead of call out sick, but they're doing little more than exhaling carbon dioxide. And that doesn't help you or your bottom line. Each year, as we do negotiations or as we run our businesses on the private side, we see the cost of call outs, presenteeism, and associated health care with really a lifestyle that's ill recommended when we talk specifically more about smoking. Last slide on this, the continued costs. We talk about obesity. Obesity, as I've done this research for several years now, is the cause of so much: a heart attack, stroke, costs, emergency rooms skyrocketing, those that are underserved, underprivileged. They're who are affected the most by this. And they're who, frankly, the hospitals have to spend the most money on charity care. With very little intervention and education, these things can be almost completely reversed. Particularly timely is flu. And I know it's an older stat from 1995, but when you talk about vaccination, so important and timely in this particular stretch of time that we're in, to be able to reduce a virus by 60%. And I'm sure the efficacy is stronger than it was now as opposed to 25 years ago. The reduction of restricted activity work days and missed work altogether is something very easy that can be done. And it's highly recommended when the health department says, who needs the flu vaccine? You need the flu vaccine. It's not just a motto or a bumper sticker. We're hoping it catches on as a way of life. So what is the role of public health? All too often, people ask, well, what is the health department? You all go out and you do inspections. You may write violations. I can tell you I'm very proud of this health department and our leadership here. We do testing and prevention. We provide clinic services. We're advocates for our veterans, our school children, a robust and largest in the state ever WIC services program, in particular in Toms River, Lakewood, Bricktown, and not only there, but in the southern part of Ocean County as well. Environmental expertise, immunizations and preparedness for disaster, man-made or otherwise. This is all housed in this department, of which I'm one of, I believe, 225 full-time employees. So this scope of services is here for our businesses. You need only pick up the telephone. And that's why it's important. We have licensed bachelor's and master's degree prepared individuals to go out and to provide these services for you in almost every circumstance at no charge to you. So what can business do to participate and to help their bottom line? Well, if you would like us to support, maybe get some nurses out in a forum once COVID subsides, we can provide services for employees in a major forum, like for the Southern Ocean Chamber, that provides glucose readings, blood pressure readings, body mass index readings. This is all available, and it's for the benefit of your employees. And the benefit to you is a healthier employee. Supportive walking programs, and we have nutritionists on staff. We have a diabetes educator on staff who can come out for an hour or 15 minutes or 2 hours and provide and leave written information and a point of contact. So they say you give a man food, give a person food to eat for a day, teach them how to till the land and plant a crop, and they're set up for life. And that's what we do here. We want to extend the olive branch of education to our businesses to grow that relationship. Why do I want businesses in? They say, what are you doing calling banks for? Why are you calling car dealerships, other businesses and strip malls? I want to bring them in and support items in public health, because sometimes government funding pathways, as we all know, dry up. But when we extend this educational outreach and we change some lives, we're able to make a positive impact for our businesses, save our businesses money. Where specifically do the rubber hits the road? We've heard a lot, and I'll close with this, about restaurants. They've been hit in particularly hard. So when I was a health inspector several years ago, I would go out. You know, it would be a little bit tense, not here in another agency and in another state. But I saw that I had an opportunity to not only have a robust enforcement outreach, but I dovetailed that with education. The sell is easy to a restaurant or a food licensee, because if you take care of your food from the time that it arrives at your back door, through all the hot and cold holding, the preparation, to the plate, to the customer, fresh food tastes better. You'll sell more of it. If the unfortunate occurrence happens that you're a licensee, you ran into some compliance issues, you have to go to court, you keep temperature logs. You know, the courts are going to usually side on the side of the prepared. So if you have logs going back to talk about hot and cold holding temperatures, your sanitization, things like that, hazard analysis, critical control point, that not only goes to your bottom line and probably a reduction in your insurance costs, but it makes your product better, brings in more people. So I was able to sell that to about 500 licensees in Central Florida, and it's an easy thing to do. So when you're going out in an enforcement capacity in any industry, and what I just told you in the last 2 minutes, that translates into so many different areas of business. So it doesn't just have to be enforcement. It could be education. Come on in, let's show you how to do something the right way. Let's create a different program and a different paradigm. It's novel, it works. And so when you bring in non-traditional partners to a community health improvement plan, whether it's a retail outlet, a restaurant, a factory, these are some of the things in this slide that really can reduce injury, de-densify during a time of COVID, protect and insulate employees from illness, chronic disease. These are easy things that can be done in a matter of minutes. If you want more information, you need to pick up the phone, give me a telephone call. In particular, I want to go to my last slide. Hackensack Meridian Health, of course, we have a lot of fine partners at our health department, but in particular, 4 minutes and 27 seconds of your life, about 5 or 6 bullet points down, this YouTube video talks about how to open carefully, how to keep your eye on monetization and profit, and really how to protect employees. It's ideal. It is something that's there on YouTube. It's out there for the public. Of course, everything else on here, I entitled this slide, Resources Businesses Can Use Now. Our 9th district has been so above board in their efforts for outreach during this time of COVID on their website. And then I'll tell you what, for this health department and for my portion over here, I've leaned on that website at times to create links to build our community health improvement plan for the betterment of life and our 5 health indicators throughout all of our municipalities. So when you talk about not just loans, there's information on all of these websites that are in front of us now, but for different funding pathways, including grants. The CDC links on the bottom came from my good friend here, Richa Sharma. She is a really fine colleague of ours, vested in the fight against coronavirus, highly credentialed, and our epidemiologist, one of several. So I've shared this now with COBA. This is a presentation that can be emailed out to not only any person, but any business. So I want businesses to use it. I want to develop a different relationship and change the paradigm between regulator and the regulated. I think that benefits everybody. And again, I'm grateful to our administration here at the County Health Department, our Board of Health, of course, Assemblyman Rumpf, who is here upstairs in our administration, and as well as our Board of County Commissioners. It just doesn't happen without their support. And again, I want to say thank you to Commissioner Vicari in particular for his guidance for all of our businesses countywide. I say it because I mean it. People that know me know that I'm not too good at blowing sunshine around, but it's the work that a lot of people here have done for our business community. We're all very, very available. It only works if you pick up the phone. If I could support you in any way within the realm of ethical reason and the scope of the Community Health Improvement Plan, I have no problem leaving this office and coming out there and doing that. That's part of my job here as a public servant. So please pick up the phone. If there's any way I could support or try to build one of these programs at your business, let me know. Chris and our businesses, thank you for giving me the time, and I'm very grateful for your few minutes. Thank you.
Peter, thank you so much. Okay. Lori, do you have anything from the chamber side before we do the closing remarks?
Yes, I believe Kate has a few questions.
Okay.
I do. I have a few actually. And I'm going to start with actually Peter, since these are related to the health department. But I do have several for all. Is there any way for businesses to stay updated on changing protocols?
Yes, there is. And I should probably let, as a matter of course, in our administration, Brian handle that, but we do have several outreach, and I don't want to overstep, so I'll certainly give that over to Brian.
Thank you. With regard to changing health protocols, the best resource is the New Jersey Department of Health website. As we all know, CDC regularly comes out with new recommendations. New Jersey tends to lag behind the adoption and the implementation of those regulations. It may be a couple of days, it may be a couple of weeks. One recent example is travel guidance and quarantine necessitated by travel. The CDC basically came out with the proposition that if you've been fully vaccinated, you do not any longer need to quarantine after travel. I believe it took NJDOH about 3 weeks to catch up to that position, but now you can find that on their website. As a general rule of thumb, that would be the starting point, in addition to our own website locally at the OCHD.org, Ocean County Health Department.org will also provide a number of great resources.
Kate, if I may, one more piece of information. On another note, I'll change hats now as Mayor of Lacey Township, and after hearing voices in our business and law enforcement community, our educators, I will be introducing a prohibition ordinance tomorrow night at our township committee meeting for recreational marijuana. I don't think it's sound public policy for public health. I don't think it's sound policy for public safety. So I'm hopeful that I have the support, and ours will be added to the list of municipalities in our great county that will prohibit the sale of recreational marijuana. I'm hopeful. I did want to report that out to our stakeholders here in the business community, because as we have been told, I'm concerned with price per square foot for not only our businesses but also our residential real estate as well. So my determination is to go that route, and I'm hopeful that I have the support. Thank you.
The next question I have also for Peter is, will there be any rollbacks for temperature taking or masking in the office?
We follow the Centers for Disease Control and Prevention requirements. Our leader here, Dan, is a state licensed health officer, and we have several other licensed health officers as well. But again, I think that's when you start getting into overarching policy for the entire county, I'd be remiss if I didn't defer to Brian, but my belief is that I don't see how you can go wrong. If we're talking to the business community and you're talking about liability and things like that, if you're following CDC requirements, you're probably in a safe place. But again, I defer to my administrator, Brian.
I would only add to that CDC requirements are superseded by New Jersey executive orders from our governor as well as our State Department of Health. As an example, Governor Murphy was asked yesterday whether the declining numbers in terms of infections would result in a relaxation of at least the outdoor standards for mask wearing. His answer was not yet. So that comes directly from the governor and his executive orders under his established authority to issue the orders pursuant to the declaration of emergency.
Thank you. And then these next questions will be for our 9th district. Are there any concerns about when rent, mortgage, and utility moratoriums run out, and when will that be? So that could be for Assemblyman Rumpf or Assemblywoman Gove, whoever would like to take that.
Jump in. My understanding is that moratoriums with respect to utilities and rent are due to expire this summer. There's already initial discussion on extension, but we do have the competing concerns of landlords that frankly are having difficulty paying their mortgage with regard to not having received the rental payments. That applies to both residential and commercial. So right now there's a great deal of discussion with respect to the impact of any extension of those moratoriums. And then we have, of course, the fact that the courts remain virtual. They are not open for people to be able to come to the courthouse to prosecute evictions as well as other matters. And so that's a great impediment to our ability to go back to normal even after the lifting of the moratoriums.
Thank you. And then there is a question regarding unemployment and motor vehicle service issues. Are there any changes or upgrades in the works to make it more accessible?
I will tell you that I personally think motor vehicle as well as unemployment, the situation that we as residents here in New Jersey have had to put up with is ludicrous. They will close down a motor vehicle agency for one infection for an entire week. So if an employee behind the counter is diagnosed as a positive, despite what CDC has already told us on the risk of contamination from surface transmission, they literally shut down the agency. They do their deep cleaning and they don't allow any of the employees to come home, regardless of whether or not, to come back to work, I should say, regardless of whether or not they have been vaccinated or what the degree of exposure may have been. Last week, we had both Manahawkin and Toms River and Lakewood all closed, no service to any Ocean County resident. It's ridiculous. This morning, the Motor Vehicle Commissioner is actually testifying before the Assembly Budget Committee. And I know that those questions are going to be posed as well. I think we're literally weeks away from a change in policy, but I cannot speak to the governor. I can only speak to my frustration and the frustration of my constituents, probably all of you. Unemployment is getting better. We have now resolved 2,059 cases, I believe, within our own district office, or have helped to resolve that many. There have been so many. We continue to have, I believe the number now, Jason, our chief of staff, will tell us, is something like 98 problematic cases that we're still having to bring forth to the Division of Unemployment for resolution. So it's gotten a lot better just by virtue of the passage of time. Motor vehicle needs a real swift kick in the butt.
Another question is regarding real ID status, and will the MVC still be issuing even with backlogs?
Yes, they are still issuing. You can make an appointment for your real ID. My understanding is the appointment time is currently between a month and a half out. So we need to become compliant by October 1. I frankly have no idea how we're going to do that with motor vehicle not keeping their offices open. They've been a nightmare to deal with in the state of New Jersey throughout this pandemic.
Thank you. The next question is regarding hiring. It's especially seasonal. It continues to be an issue. Is the state having any input with the H-2B or J-1 visas?
Diane, I'm sorry.
Diane, you're muted.
At this point, I think we have not received anything, right, Brian?
I don't believe we have any updated information on that at the moment.
No. That one, I think you need to call Congressman Kim or Congressman Van Drew. They'd have a better handle on it because it's a federal issue.
Excellent. And then I have two more questions. So one is, how can our officials encourage constituents to take the vaccine?
I personally believe there are a number of ways in which we can do so. One is, of course, by example. I received both doses of the vaccine, and I don't mind telling people that I've done that because I not only consider it good for myself and my own health, but as an example to others. I come in contact with hundreds of people every day, and so I consider it an obligation to protect the health of others to get the vaccine, to keep myself healthy so as not to spread this terrible disease to others. And that's the messaging that we need to get out there. I know Peter Curatolo from the health department is working on programs to get that messaging conveyed, and he shared part of that with us this morning. We need to see an abundance of that, and we need to make it easy and abundant the vaccine itself so that people don't have an excuse for which not to take it. Obviously, there are going to remain those that are skeptical, and this is America and we're entitled to our own personal liberty. I understand all of that, but for those that are amenable to receiving the vaccine, we need to do everything possible to convince folks that it's not only safe but prudent, and you're helping others by doing so.
And I think what Brian has said in the beginning now, there was just so much difficulty getting them, but now there's no reason. So you just try to help people that now you can get them, go get them, please go. You know, it's not like he said, you can just walk in or call in, right? You just walk in, or do you call Brian?
Many places are allowing walk-ins.
So there's no reason if you want it, you can't have it. So you need to support them that way.
I've made inroads by challenging people with science. I mean, when you look at the numbers of adverse reactions, so-called adverse reactions, compared to the amount of vaccine that has actually gone into people, I think it's incumbent on people to tell the whole story. Absolutely. Always defer to a medical professional because everyone is different. But let's try to tell the good news here, that on December 24th, this vaccination came out. We're right around there. And, you know, how many lives have been saved because of it so far? You could talk back, you know, part of my position here is immunization compliance for early grades and preschools. You know, you think back to polio. Many years ago, a lot of people my age and younger, we never saw someone with polio, but that's a disease that was almost completely eradicated by vaccine. So it's important to keep politics out of it and everything in science in perspective when you're having that discussion.
Excellent, thank you. And the last question I have is from Elizabeth Burke-Beatty, who is with Sea Change RCO. And her question is that she is a new 501c3 nonprofit, finding it difficult, close to impossible, to get some of the funding that was mentioned earlier through DMHAS and DOH. And they're new, but not inexperienced, and have already served over 150 individuals and families in Southern Ocean County. And how can they work more on getting these available funds? This may be something I need to share her contact with you through an email. That might be best. But
I think that, yes, I think it would be better to do that. That way we know exactly what she's done, and I mean, where we can help her, because it is all new. They've only just been passed. So that way, I think that would be more on a personal level. So if you contact our office, or Kate, you tell her, you know, let's work it that way.
Mm-hmm.
And I would be remiss, Kate, if I also didn't mention that so frequently over the years, we find there to be a great resource coming from Commissioner Joe Vicari and the offices that he oversees. And so I'm sure he would welcome the inquiry directly to himself as well. He's been vital in seeing the non-for-profits and the charitable institutions grow in Ocean County over the last 30 plus years, if I'm not mistaken, Commissioner.
What I can do is I'll send an email, if that's okay with Elizabeth, and I'll CC everybody on that, and then we can at least get that, because that's very specific. So
Perfect.
So, and that's what I have for questions. So I'll turn it back to Chris.
Great, thank you, Kate. Lori, do you have anything else to add?
Where's Lori?
I'm right here. You know what? I believe, Chris, you have some upcoming dates
Yes.
to share. And other than that, I think we're all good. But I wanted to, again, just thank everyone for being part of the call. Our District 9, family, and Peter, and of course, to see Commissioner Vicari here is always wonderful. So again, please follow what we're doing. We share as soon as we get information. We put it on the Southern Ocean Chamber Facebook page. We link it to a blog. We visit LBI region. page, and we also do a radio show every Monday morning that updates everyone. So just please, our office is open every day, Monday through Friday. So please just utilize us as a good way for a jumping point to get you where you need to be. So thanks again for being here this morning. And Chris, please close it out.
Thanks, Lori. Just a couple upcoming events before we sign off. This Sunday is our annual Wedding Roadshow. A lot of local members and vendors are taking place in that. If you or know somebody who still wants to attend it, you can register through the chamber. On April 27th, Women in Business Women in Business meeting is at the Terrace Tavern at 10 a.m. On April 27th is an SBA restaurant revitalization webinar, which is at 3 o'clock. May 5th, Attorney John Fansberg will be doing, I believe it's a virtual meeting on cannabis in your business, which is at 10 a.m. On May 26th is our kickoff to summer, Get Acquainted party at Fantasy Island from 6 to 9 p.m. And on June 9th, which we do every year, is our New Jersey Office of Homeland Security reopening Hometown Summit. Again, all this information is at the chamber. You can call the chamber, go on the website to register. And again, if anybody has any questions that come up that after today's discussions, please feel free to reach out to us. Kate's at the chamber, Lori's there. We'll get you in the right direction if you have some questions. So thank you to everybody who attended today, and special thank you to all of our speakers. Great information today. So that's about it. So have a great day, and everybody take care and stay healthy.
Thank you
so much.
Thank you.
Thank you so much. Take care. Thank you.
Take care.
Have a great
Bye-bye.
day.